Hi, my name is Amelia. I am an Accredited Exercise Physiologist here at Acacia Well-Being, and I'm also a research student at QUT. Chronic fatigue is both a symptom of a lot of different illnesses such as cancer, mental illness, neurological issues, but it is also a disease in its own right. When it is a condition, we call it myalgic encephalomyelitis or chronic fatigue syndrome. We can tell the difference between chronic fatigue and chronic fatigue syndrome by a symptom called post-exertional malaise, which is where after any normal activity, could be just getting out of bed, maybe going to exercise, or even mental activity, they get symptoms of severe fatigue, sometimes neurological issues, difficulty standing, they could get lightheaded, dizzy, but mainly just exhaustion. It's almost like a crash. The challenges that people with chronic fatigue face are basically mostly due to the post-exertional malaise. When something like getting out of bed makes your symptoms worse. It means that it's harder to go to work, hold down a job, go do your shopping, clean, just all those general maintenance things that you need to do as a person. So it's incredibly disabling. Everyone with chronic fatigue will have different symptoms. They'll have different things that affect their fatigue, different things that make them worse, different things that help them to rest. So the first steps to take with getting assessed is to first make sure that you have chronic fatigue syndrome and not chronic fatigue due to something else. So seeing a GP, getting blood tests, ruling out all the other causes of fatigue is really important because that helps us narrow down how you're going to respond to exercise. And after that, see an accredited exercise physiologist, but importantly, an exercise physiologist who has experience or interest with chronic fatigue, because there's a lot of information out there, unfortunately, that makes it a really difficult disease to navigate. But finding someone who understands chronic fatigue, who understands how it's affected by exercise, can help you to exercise and move in a way that helps you, whether you want to get back to work, whether you do have an exercise goal like walking or even running, or you just want to be able to get out of bed and have a shower.